Hi, good afternoon, everyone. Thank you for joining us today for our very first Talent Talk of the new year. We are super excited to have our Ochsner Lafayette General team joining us for this very first Talent Talk. Today, they're here to cover just a little bit more about their locations, the regions in which they serve, the benefits that they've experienced by partnering with Ochsner Health, as well as some of the new opportunities they have available to join their fantastic team. Before we jump into our questions, I really think it would be an awesome time for all of our panelists to introduce themselves to you. So Sheena, you want to go ahead and go first and kick us off?
Absolutely. Hi, everyone. We're so excited to be here today. I'm Sheena Rossonnet, the Vice President of Ochsner Lafayette General. I've been with our organization for 10 years after deciding we missed Meemaw and crawfish too much. So headed back home and was welcomed with open arms by our family here at Ochsner Lafayette General.
So I'm Patrick Gandy. I serve as Chief Operating Officer for Ochsner Lafayette General and Chief Executive Officer for our main campus, Ochsner Lafayette General Medical Center. I've been with the organization for 25 plus years. I originally moved here thinking I would be here for 3 years. I married a girl from Orneville, which is a small town just north of Lafayette. And 25 years later, I'm still here, but the community's been great to me. Ochsner Lafayette General has been great to me, and very excited to be able to share a little bit about our story today.
Good afternoon. My name is Amanda Logue. I am the Chief Medical Officer for Ochsner Lafayette General. I moved here, I am from Baton Rouge originally. I moved here after my residency in Memphis with a growing family, and started as an internal medicine hospitalist doctor. Got a lot of experience with working with our floor nurses and our support departments, and really got to see everything about the main campus firsthand, and learned a lot about people and healthcare through that. I've had a variety of leadership roles throughout the way that have taught me things about technology and population health and the growth of the health system. We moved here because Lafayette was a growing community. We could see that it was a progressive community with a culture of academics and arts, and a lot of culture here that was different from Baton Rouge. And I also noticed that there was significant growth and movement with Lafayette General itself. And I can say 11 years later, I have not been disappointed. We've been really excited to be part of Lafayette General, and just as excited to be living in this community that is changing and always bringing us more excitement. And we're very happy to be here. So thanks for joining us today.
Well, fun to follow Dr. Logue. Hey guys, how are y'all? My name's Al Patin. I serve as our Chief Operating Officer for Lafayette General Medical Center. I've been with the organization a second time since 2013. I'm a registered nurse, and I'm not a transplant. I've been here all my life. I actually met my wife in nursing school, and we had big plans to find our place in the country. And we traveled around for a good while and enjoyed that, but recognized very quickly that Lafayette was home, and it was a very easy decision to come back. Like I said, I've been here since 2013 in a variety of roles, one of which has been working intensely with our physician group. And it's always great to get our physicians on a site visit, because once we get them on a site visit, we usually can keep them. Lafayette's a great place. So thank you for having us.
Hey, good afternoon, everyone. My name is Herbert Juriet, and I serve as the Vice President of Ambulatory Clinical Transformation. In that role, I actually work with Dr. Logue and also with Al, really to improve the quality of care in our physician offices. I am a nurse practitioner by trade of many, many years. So I think that brings a unique understanding of what it takes to not only run, ambulatory practices, but also to improve patient care and the patient experience. I've actually been with Lafayette General 7 years as of yesterday, so definitely timely. But I look forward to further conversations with the panel this afternoon.
Last but certainly not least, good afternoon, everyone. My name is Tanya Bolden Ball, and I've been with this phenomenal group for a total of 8 days. 8 days that have been mind blowing. Yes, I'm almost at the 2-week cut, but I serve as the new regional director of diversity and inclusion. This position is new not only to Lafayette General, but to the entire Ochsner system. And it's just very exciting to be a part of this. Although I'm new to healthcare, my background really encompasses higher ed, secondary education, nonprofit, from serving as executive director of a nonprofit to several times being the president of board, multiple board of directors. I'm just excited. For me, community, it means a lot to me. I'm married to Navy guy, retired. He is from Texas. And we decided after he retired to make Lafayette home because Lafayette really meant a lot. Great foundation as pertains to education. And just to be a part of this group who's proactive about being change agents mean the world to me. So I'm excited to be a part of the team. And yes, I make 2 weeks on tomorrow.
Yes, thank you. Welcome to the team, Tanya. We're definitely glad to have you. And then also happy anniversary to you, Herbert. 7 years, and I know you've already made quite the mark in that short time frame. Well, I guess 7 years isn't that short, but quite a mark in that time that you've been with the organization. Before we jump into our questions, we've talked a lot about how Ochsner Lafayette General serves the Acadiana region. And Patrick, I think it would really be excellent for you to describe a little bit more about what you mean when you're talking about the Acadiana region and all the communities in which you serve and the scope of care that Ochsner Lafayette General provides.
Yeah, I'd love to. Acadiana is defined really as Lafayette Parish, and then the 8 parishes around Lafayette Parish. In that market, we serve about 650,000 people. That's what we consider our primary and secondary market for Ochsner Lafayette General. So that's the market, and we're in South Central and Southwest Louisiana. Our organization, Ochsner Lafayette General, is much more than just Lafayette General Medical Center, which is our main tertiary center. But we're comprised of 7 hospitals, 7 campuses throughout the region, with facilities in Breaux Bridge, in Crowley, in Kaplan, and we have 4 campuses in Lafayette proper. So much more than just our tertiary center, Lafayette General Medical Center, plus our physician division, LGMD, is comprised of about 80 physicians in 38 different locations throughout all of Acadiana, with the goal of creating as much access as conveniently as possible to all the populations that we serve. So our mission is to restore, maintain, and improve health. And we strive to do that every day in all the communities that we serve throughout South Central and Southwest Louisiana. So Ochsner Lafayette General, we have right at 4,500 employees. We're the largest private employer in South Central Louisiana, and have had great success and growth over the past 10 years as we've increased our presence throughout South Louisiana and are the market leader across all of our main tertiary services, cardiology, neurosciences, oncology, offering a full range of services at our tertiary center. And then at all of our other campuses, all of those services that each of those communities can support. And so our primary objective is to keep patients local. We feel that local care is the best care. So as many patients as that can stay in Crowley, we want them to stay in Crowley. If there are services that they can't support in Crowley, then they come to Ochsner Lafayette General Medical Center in Lafayette. So that's our philosophy, a little bit about who we are as an organization and where we're located.
Thank you, Patrick. Another question for you. I know that Lafayette General Medical Center has been serving patients in the region for over 100 years, which is quite the accomplishment. And you guys obviously have a very big footprint within your region. Can you share some of the biggest, I'd say most proudest moments of the health system to date?
Sure. Yeah. Lafayette, it was originally named Lafayette Sanitarium, which is, that's a really exciting name, but founded in 1911. So serving our community for well over 100 years. And as we look at the changes in the organization, some of the most proud moments that I've been part of, as we look at the growth, number one, our first facility that we added to our health system was St. Martin Hospital in Breaux Bridge. So that was a big deal. We were really excited that really moved. Al's excited. He's from Breaux Bridge. So, adding that facility in Breaux Bridge, that was our first. And it moved us from being a single hospital to our path to becoming a healthcare system in South Central Louisiana. And, second would be the total renovation that our facility underwent about 8 years ago. The original facility at Lafayette General Medical Center, our main campus, was built in the 60s, and so we definitely needed to make some capital improvements. And so our board approved an $80 million investment in Lafayette General Medical Center and totally renovated the exterior of the facility, but the interior of the facility, all new patient rooms, and it's a gorgeous facility. But what I'm really most proud of is as we went through that renovation on the exterior of Lafayette General Medical Center, our culture as a hospital and as a healthcare provider underwent a similar transformation, and we really became focused on creating a culture of service and really focused on employee engagement and physician engagement, because we feel strongly if you have engaged employees and if you have engaged physicians, then that's going to improve the quality of the care that we deliver, and it's going to create excellence across everything that we do. And that really started at that same time as the renovation of our hospital. We had a renovation of our culture and that cultural transformation within our institution. So we have many other very proud moments, but I would say those would be the top two.
Yes, absolutely. It's very obvious that you guys have a strong culture, just even amongst this group. I've been able to witness it over the past few weeks working with you. I kind of want to go back to something that you said about providing care locally and how that's very important to you. And I want to ask this question to Dr. Logue. I think it's really important that we discuss access to care in the Acadiana region and why it is so important to you guys to serve this community.
Yeah, Morgan, I don't think that we have a unique situation here. Anybody that serves a community that has rural areas knows that the traditional way to access care is hard. It's hard for people to get what they need at the time they need it, going back to the way we've done it forever. So we recognized, very early on that we had to make some changes. We needed to bring services to people that live in the areas where, nearby a facility that they already love. They can't be expected to come to Lafayette for everything. But you have to do that with the right information and right ability to be able to serve those. So yeah, as Patrick was talking about our expansion into these other markets, after we have gotten our system to the size where we have a lot of representation in many of our parishes, we then started moving on to what kind of new services does that community need. And so just for an example, we've been able to bring cardiology services and wound care to our Ochsner St. Martin Hospital in Breaux Bridge. We've been able to bring orthopedic surgery to our Ochsner Acadiana General facility. And I mean, it's just really inspiring, and it's very rewarding for people to not have to come to Lafayette to see specialists. It brings more access for them, and it also brings more jobs to the area as we are able to expand in those regions. We have a lot of plans coming up that are going to be really bright and shiny new objects in Lafayette, especially with our new expansion of our main campus. We have not seen a slowdown in people needing healthcare services in Lafayette. We want to be able to have people come to us that need the highest level of care here. So we're expanding those beds as well. We've also, though, done a lot of innovation around the other ways to access healthcare. So certainly telemedicine. We were on that journey for years before COVID hit, and really experimenting with how does somebody get good access to care through telemedicine. And we were really feeling it out and allowing it to our employees and to our patients out there. And when COVID hit and we needed to scale up very quickly, we were prepared. And so we've seen a huge shift in that work, and of course see it, maintaining itself going forward. It's just going to continue to be an important area for access for patients. Another example is our teleconsultation with Ochsner main campus in New Orleans. We have patients that are here seeing our cancer doctors that are going to end up needing a transplant. And we don't do transplants here, but we do in New Orleans. And so we're able to connect those patients here at their doctor's visit with their new doctor that's going to take over their care in New Orleans without having to leave anywhere. And it just decreases the anxiety of the patient. It allows really good collaboration between the care teams. And we feel that these kind of, methods of getting healthcare to people out there is the future. And that's where we continue to put a lot of our efforts.
Dr. Logue, you bring up a great point that I think is important for us to highlight. A big benefit of the merger with Ochsner Health. Ochsner Health is making a $94 million investment in our communities, in the communities that we serve right now. And so that is going to result in a very dramatic expansion of services at Ochsner Lafayette General Medical Center, an investment at our Ochsner University Medical Center here in town, which Ochsner Lafayette General Medical Center and Ochsner University Hospital and Clinics are the two teaching hospitals in our community. So we're training the healthcare providers of tomorrow at both of those campuses. And that investment from Ochsner Health is allowing us to expand those services, not only at our Lafayette-based campuses, but throughout the region, and investing in those services, which is going to allow us to keep more patients in their local communities, because again, local care is better.
And bring more jobs to the area. We can't fill those beds without having a significant increase in our workforce.
Yes, absolutely. And I think you guys both bring up a great point about having an infrastructure set up even pre-COVID that you were able to build upon, and we're going to see continually expanding across the region. So I think that's fantastic. Herbert, I want to pull you into this conversation because I know you've done a lot of great work around population health for this, for the Acadiana region and your communities. You want to share a little bit about some of the things that you brought into the organization?
Yeah, thanks for the question. Whenever I think about pop health, I think about, my initial role at Lafayette General at the time, implementing the concept of patient-centered medical home, really that serving as the foundation for our primary care clinic in understanding what are the essential elements to truly be able to be ready, to provide more holistic care. Kind of going back to one of the questions when looking at access to care, that was one of the most essential components of pop health is access to care to PCP services. Having access to care has a wonderful effect of decreasing unnecessary emergency department utilization, but it also connects the patient with the provider who actually knows them, has a healthy understanding of their health history, understand their medications, and really can treat the patient a little more holistically. kind of fast forwarding to some of the work that we've done in regards to pop health, we really have taken a holistic approach in looking at the patient as truly being the center. Traditionally, patients are, we can say, medicine was more of a top-down approach in a sense of a provider would come up with a medical plan of care, and from that, the patient would either follow that plan of care or not. We've really changed it where the patient really is the center. We've implemented a team to be able to support the provider to ensure that plan of care is initiated. We have care managers who actually assist the patient after their visit to ensure that they understand their plan of care. There's nothing more frustrating as a provider than coming up with the perfect plan of care for a patient, but in turn, the patient either doesn't understand their medical condition, doesn't understand why they need to, follow that plan of care, or they can't afford, that plan of care. So our care managers really work with our team, with the patients, and with the care teams within the physician offices to ensure that we're able to remove any barriers to care, if it's being financial, psychosocial, transportation. Those are all things that our care managers really work with. We also apply that to our employee population. We have a nurse navigator who works on my team, and her focus really is looking at, patients with chronic conditions, but a lot of the work that she does also looks at making sure that they have access to any type of assistance that they may need, or really tying them into a PCP. I think the focus, of really another element of my team really looks at engaging the care team and the providers. And it's really about education. It's educating the providers on any changes in standards of care, but it's also educating the care team. I am a consumer of healthcare within our PCP clinics, as is my parents and also family members. So I think it's important that regardless of who you are, you're able to receive the highest level of care locally, and that's the thing that we really strive. Timely, high quality care is an essential component of healthcare, and that's what we strive to deliver.
Yes, absolutely. And I think that's been a consistent message across everyone on the panel so far. It's just delivering most high quality care for the patient and engaging them in the process. I love to see that. I do kind of want to shift lanes a little bit and talk more around culture of the organization and more the employee base. Everyone on the panel has shared their love of the region, why they love the Lafayette region so much, which I appreciate you guys for sharing that. I too love Lafayette and cannot wait to go visit very soon, hopefully, visit with all of you. But Al, I want to direct this question to you. I want to know more about what you love so much about working for Ochsner Lafayette General and about the people that you guys employ within the region.
Yeah, Morgan, it's an easy question, and we're going to get you to Lafayette. I think you're going to move permanently here by the time we're finished. That's an easy question. It's one in which my wife and I talk about a lot. I said I started here in 2013. I was out of the hospital prior to that, but I had a contract relationship with the hospital, so I had a chance to visit in a business relationship, and I'd go home and I'd tell my wife, I was like, something's different. Something's different about Lafayette General than the Lafayette General I remembered. It feels differently. The people are responding differently, and I got a yearning for that to the point where I wanted to join that team and understand what is this. And ever since then, I've recognized that a lot of people talk about culture in their workplace, but I think our culture really centers around two important factors for me that make it valuable. One is a culture of transparency, and one is a culture of accountability. And I think we do both very well. And ultimately that transitions and transfers to our employee base in the term of value. So a couple of examples of that. I think to start off with, our talent acquisition process has been proven to be extremely valuable to our recruitment efforts. And what I mean by that is we have a leader interview process, all led through our HR team. We have a leader interview process, and then we have what's called a peer interview process. And that may sound familiar. Many organizations have that structure. But what I think is unique and valuable about our peer interview process is we're only placing high performers on our peer team. And those are colleagues, people that will work with this particular individual. And once we release a candidate to the peer team, that leader is saying, I've placed you guys in control of this decision, and you are going to decide who you work with, because I believe you're a high performer and I want to recruit someone just like you, right? So we're placing that decision in their hands, and that has proven to be the most valuable recruitment opportunity we have. So I would say that's the first the first example of a culture of accountability. They are accountable for recruiting their peers, and it's a beautiful thing. The second one, Patrick mentioned service, and there's a lot to that, right? That's an acronym for us. It holds our values, and it holds behaviors within those values that every one of our employees hold each other accountable for. So service is an acronym. It's supportiveness, etiquette, respect, vibrancy, integrity, communication, and excellence. And each one of those has behaviors, measurable behaviors underneath them that everybody is familiar with. And when we recognize people exhibiting those behaviors, we like to celebrate them and reward them and recognize them. And one of the newest ways we do that is with an app. We call it an endorse app. It's a quick way of recognizing the behavior that we want repeated. And it gives people that recognition that they need in the moment. So values and service would be number two. And then I think the biggest piece from a business perspective is how we develop our goals by division, how we cascade those goals, and then how do we routinely communicate that to our employees. So we go through a very routine, hardwired process where we develop achievable goals at the entity and org level. And then each division develops their particular goals. And the goals sit within our key columns, right? Patrick talked about people are first, our service goals, our quality goals, our finance goals, and our growth goals. So we set those goals and we communicate those results to all employees across the system once a month. And the cascading of that information is pretty cool. It starts at our board level. Then we have a system leadership level. Then we have the department levels and then entity levels. And everybody gets results communicated to them within a 2-week period across the entire system. And that's the transparency component. All employees know what our pillar boards are, where we are on our metrics, what gaps we need to close. And that's a pretty cool thing. And I think the last but not least, certainly COVID has impacted our ability to do it this way. But I think one of the secret formulas that we have is the way we do employee forums. I think that's special to our team. We do those on a quarterly basis typically. Now we're doing them virtually, but we communicate our results of our goals, any major updates, and then we allow for about half of that time for Q&A from our employee base. What's on their minds? What are their concerns? And that's another component of consistent feedback and transparency. And all of that, right? All of that, Morgan, circles around our journey to excellence. Really, that's all encompassing. That's what we call it. It spills over into our non-work life, right? We use the language of leadership. I do, for sure. My kids tell me all the time that I speak a lot about vibrancy and accountability, and so we use the language. It spills over into general life, and I count that as a blessing. Pretty cool stuff.
Yes, absolutely. It sounds like you're preparing them for the workforce and to join the Ochsner Lafayette General team in the future. I love that. And I really loved how you spoke about transparency and communication and how important that is, especially when it comes to cascading of goals. I know Al, as a former nurse and clinician, I know that probably means a lot to you now in a leadership role. And Herbert, I'm gonna pull you into this conversation because I know you've talked a little bit about your experience working as a nurse and nurse practitioner. You've had a very tenured healthcare career before joining the Lafayette General team. I'm interested to see what drew you into this organization after working in healthcare for so long in the region.
All right, thanks, Morgan. I suddenly feel old, but actually, as I started thinking, I have been a nurse for 27 years, even though it doesn't seem, that long, and I've been a nurse practitioner this year for 23 years. So I definitely, as I think back, I do have some experience, but I was with a different health system for 20 years. So I was working on a doctorate in nursing practice, started in 2010. And it was interesting, first professor told us that 50% or more of us will not be with the same organization that we're actually in at that time. And I kind of laughed and said, I've been at the organization for 17 years. I was going to retire. But as I went through the courses and actually was working on my dissertation, started thinking, in a sense that maybe there's something else out there. One of my colleagues actually, who didn't work for any of the organizations, told me about a position that was open to help implement patient-centered medical homes in the primary care clinic. So I decided to apply. And then Al actually called, and he and I were catching up actually, and I kind of said, wait, why are you calling? Ended up talking, a good bit, and he told me about the position. And really, I still wasn't sold. So I came in for the leadership interview and also had an opportunity for the peer interview. And, I looked at it like this. Worst case, I was going to be able to refine my interviewing skills since I hadn't done it in a while. But the peer team actually, they really were passionate about what they were doing. They were truly engaged. And they really were the ones that got me thinking, about the position. The other thing, as I went into the interview, I really was interviewing Al and interviewing the peer team to make sure that it was a fit, because really there was going to be no reason for me to leave another organization where I was pretty much planted. But through that process, I really took a step back and realized that there was something special. As what Al said, it was very different from what I had experienced at a faith-based organization. It felt like home. So, I made the difficult decision and have not looked back. But one of the things that was quite interesting, and Tanya can definitely, appreciate, I remember the first week I was in orientation and I was going to the hospital, and I got on the elevator and 2 employees thanked me for joining the team. So I kind of looked around to see, how do they know we wear a service ribbon while we're in orientation. So at that point, I really knew it was the correct move to join the team, because it was something that wasn't scripted. It was something that truly was part of the culture, and definitely was excited, to be part of it, as I've been here for 7 years.
Morgan, we couldn't be happier that he joined the team 7 years ago. He's done a phenomenal job. And I think, when Al puts all of that into perspective with what we do here, it sounds a bit overwhelming to put it all into place. But I think what it boils down to for people, because I've seen it time and time again here, is that people just want to come to a place to work where they connect to their purpose, and we can show that time and time again, and they know what to expect when they come to work every day. And I think that's a lot of what it boils down to. And no matter what you call it, with all of the structure we have in place, that's what we aim to deliver every day, is to give them the reason that they're here, remind them of their impact, no matter what their role is here, and also to understand what your expectations are. And people thrive on that.
Dr. Logue, I would agree. That's a great way to summarize it. I do take credit for Herbert coming on board, just so everyone knows. But he mentioned a couple things, Morgan, if you don't mind, I'm just going to chime in a second. He mentioned the orientation process. And we have an opportunity oftentimes to stand in front of our new new team members. Every 2 weeks, we have a system orientation. And often what we hear, why did you choose Lafayette General? How did you get here? Have you been in a healthcare system before? And oftentimes we hear something different about Lafayette General. There's something that people are talking about. And it's really, just like Dr. Logue said, being able to go home each day and recognize that you fulfilled something very worthwhile and meaningful. And at the end of the day, that's value to you.
Yes, it's very obvious, the culture that you guys have. And I think this whole team is a big part of making that impact and trickling it down through the transparent communication and the goals. So I love to hear it and love to see everyone's passion around this topic, because truthfully, we spend so much time at work. We want to make sure that we feel connected. I love, I think Herbert mentioned part of a family. I love that. And I know for me, it's super important in my working life. So I'm glad to see it at Lafayette General. It's very obvious. I want to talk a little bit now about the benefits that you guys have seen since merging with Ochsner Health last fall. I know, Patrick, you touched a little bit on some of the benefits for patients, but I wanted to see if there's anything else that you maybe want to add about the merger that you've really been able to see some changes in the positive direction for your team.
Yeah, absolutely. So the merger with Ochsner Health is something that, as an organization, we've been working on for almost 3 years. So it's taken a while, but it was certainly worth it. Before we were Lafayette General Health and became Ochsner Lafayette General through the merger. As Lafayette General Health, we had conversations with our board about our plans and where we needed to go as an organization, and felt it was important for our organization to become part of an even larger organization because of the benefits that it would provide to our patients and all the communities that we serve, but also to all of our employees. And there are a number of significant benefits of being part of a larger organization because you have access to additional resources that we wouldn't have available here at what was Lafayette General Health. Being part of Ochsner Health and now Ochsner Lafayette General gives our employees access to additional depth and breadth and resources and support to help them do their jobs on a daily basis. Access to, in some situations, enhanced benefits, and so that has allowed us to be more competitive in the workplace as we look at our benefit offerings. And so when you're in that type of situation, bigger is better. And that gives us a great advantage, we feel, over the other healthcare providers in South Central and Southwest Louisiana. So it's really been a big win for our organization and for our community, not only because of the capital investments that I talked about and the enhancements in service, but what it has done for our organization and access to additional resources and benefits for our employees.
Yes, and Sheena, I want to pull you in here to kind of talk a little bit more about the benefits for the employees since the merger last fall.
Absolutely. Thank you. And I hope everyone can see the recurring theme through what everyone is sharing with you this afternoon. It's people, whether or not that's patients in our community or our own employees who are ultimately our patients as well, as even Herbert alluded to. People come first for us. And so that's been the huge win with the merger with Ochsner Health. For example, we increased our minimum wage for the organization for the second time in my tenure, and now we're at $12 an hour, and that's huge. As Patrick talked about the growth and the investment into our infrastructure and our buildings, Dr. Logue had a great plug for more jobs, and yes, that's absolutely accurate, is that with the growth and adding beds to our facilities, throughout the entire region and all of our parishes that we serve is that we're adding more jobs, and that's not just clinical jobs. The unique piece about healthcare is that we have positions from support services, ancillary services, your professional services, and your clinical services. So it's almost its own little city within Lafayette and the Acadiana region. Some of the enhanced benefit offerings outside of enhancing our 401k plan is also our workforce development programs. We're very excited to be partnering with our local university and community colleges by adding programs such as MA Now, as well as an LPN apprenticeship. Those are the first two that we're starting out and embarking upon. We already partner with our local colleges and universities on surgical tech programs and adding radiology tech clinical slots to our area. So all of that with the nursing that we already support as well, because we continue to add beds. Our patients still need us, and that means that we still need you, and we need people to join our team and become part of our family. People is really what drives us, and without our people, we are not able to serve the community that we love so near and dear to our hearts.
And Sheena, you talk about people, and one thing that we've found as we've gone through the merger is that, Ochsner Health and, our teams at Ochsner Lafayette General, we were so similar in so many ways, and that's what's made this merger so successful as well. But both organizations are very focused on people, and in healthcare, our people drive everything. They drive care at the bedside, all the support services that support our care givers and taking care of our patients on a daily basis. It all starts with our people, and that's where we have to be focused, because as I mentioned before, if you have a strong culture, you have a culture of engagement with your employees, then you're going to have great quality, and you're going to have a great experience, not only for our patients, but for their families.
Yes, and I love the recurring theme of people. And I think, I've been with Ochsner Health for almost 6 years. It'll be 6 years in just 3 months. And that's something I've consistently seen during my time. So I'm glad to see it reflected in Lafayette General team. And it just excites me even more about the work I get to do. I do want to continue, though, talking about people. Tanya, you mentioned that you are new to the team, and a little bit about your scope of work as Director of Diversity and Inclusion for the Acadiana region. But I really want to have you share a little bit more about diversity and inclusion work and what it means to the organization as a whole, and what you hope to bring to the people of Lafayette General.
Thanks, Morgan. People often ask, and I've heard this question time and time again, especially with the tone and tenor of what our country is currently going through. People often ask, why are you needed? Why is your position needed? What is D&I? And I tell people all the time, this is one of the best examples I use. If I'm going to invite someone to my home, I need to make sure that when they have a seat at the table, they feel welcome. And when you take a look at one of the things that I did when I was considering to choose Ochsner, as my next employer, I did some research on the website, and I took a look at their standards of behavior. That stood out because when you look at the word supportiveness, etiquette, communication, excellence, and there are several others listed, I think wow, I would really feel a part of that. Feeling a part of that really ties into inclusion. So one thing about D&I, we're working under the auspices of our Chief Diversity Officer, Deborah Grimes. We have to make sure, whether it's the patients and or the employees, everyone has a sense of belonging, because it doesn't make sense. It will not work if we're providing great patient care, but our employees don't feel welcome. Our employees don't feel wanted. And I can actually say, Herbert talked about the yellow ribbon, and here's my yellow ribbon right here. I wear it with a badge of honor, because look, if I'm lost, someone's going to help me, because they're going to see my yellow ribbon. I'm going to feel welcome. And when you talk about D&I as pertains to this, our job is to make sure we're creating a sustainable environment as it pertains to employees, a sustainable environment as it pertains to patients. But we want to make sure we're not only doing that, but we're taking a look at, are we providing cultural awareness and equitable care? Are we making sure that we're creating diverse and inclusive leadership? Are we creating an inclusive environment for everyone, providers, employers, patients, staff, and also making sure, and this is the other thing I was very intrigued by, even supplier diversity, want to make sure that that practice is not just honed in one particular area, but it's diverse. So when you think of diversity and inclusion, you want to make sure that everyone at the table feels welcome and they have a seat, but not only having access to the menu, but they can afford the items off the menu. So one thing that we're going to take a look at is we're going to create a regional diversity council. It's going to encompass representation from all over Lafayette General Health System. But not only that, Ochsner has 8 employee resource groups. We're going to start off with 3, and I'm very excited about those, because the great thing about employee resource groups, you're making sure that people have a voice. And oftentimes when you're taking a look at things, you may be thinking one thing, but when you have a conversation with people, they'll provide a different perspective. So we're going to start off with, there's going to be employee resource groups for women, young professionals, African American. Those are just 3, and we'll even eventually add veterans and some other groups. But everyone is going to have a seat at the table, and we're all going to be listening. Patrick's going to be listening. Al's going to be listening. Because at the end of the day, if we don't listen to our colleagues, our employees, we're just really wasting the invitation to the table.
Yes, and I'm so excited to hear about the work that you guys are going to be doing, and then see the Ochsner resource groups get put into place in the Lafayette General community. I think that's just going to be such a great enhancement for your people. It is something that we're constantly receiving employee feedback on in terms of satisfaction around having that voice, and able to, really connect with their colleagues and their peers on these very current issues. So I do appreciate that. Thank you.
Morgan, if I can add one more thing, the announcement about me joining the team went out on yesterday, and I wish I was able to show the plethora of emails that I received. I was like, why is my phone dinging so much? And I looked, I was like, oh, and my heart really got full, because people want it. And the great thing about this system is they are proactive. This isn't about, let me just be frank, everybody's riding the DNI wave, but Ochsner Lafayette General isn't riding the wave, we're driving the bus. And we want to be proactive in driving the bus and making sure that this is not going to just be something for 2021. This is going to become a sustainable movement. And that's the important thing. If I don't say anything else, I want people to understand diversity and inclusion is embedded without the title. It's already embedded into Ochsner Lafayette General, but now we're just making it more visible and really going to use it as a teachable tool. But I'm just excited to be a part of this. And diversity and inclusion is here to stay with Ochsner Lafayette General.
Yes, absolutely. And Tanya, you're part of a bigger team that supports diversity and inclusion across the system, and that was put into place in 2020, at the start of 2020. So I'm excited to see this group continue to grow and to see the great work that y'all do. So thank you so much, and welcome to the team. I do want to kind of pivot a little bit and talk about COVID-19 and how it's impacted you guys at Lafayette General. I think that's, it's a current topic and a current trend, and we would be remiss if we didn't touch on it a little bit. So Dr. Logue, I want to talk a little bit about the organization's response to COVID-19 in your communities, as well as most recently vaccine administration across the region.
Yeah, Morgan, it's definitely very current, and I feel like I can't possibly follow Tanya. I think I could listen to her all day to teach us, to take us to the next level. I'm so excited to work with her. Just hearing her and her excitement about being part of the team, I'm really looking forward to that. So, but to talk about COVID, because it is, it's still here and it's still a part of everything we're doing these days. If I were to, refer back to, what the panel and Al have said about our culture and connecting to purpose and transparency and everything, it's that kind of baseline level of work that we do every day that allows us to be able to take on a challenge like COVID, you have to have strong teams, and those teams will go to work for you. They will do it. They will get the job done. And it's not just, the bedside nurses. It is the respiratory therapists putting their lives on the line. It's the doctor culture that we've also created. They've seen us go through the past 10 years, this transformation. And we have very strong alignment with some independent doctors, our employed doctors. And time again, over the last 10 months, we have called upon them in the most remarkable ways. And they have showed up and done the job that needs to be done. People get burnt out, and we do our very best to be able to support them through that. We try to do things, things that allow them to take some time off, or to do some different positions, or allow them to give them some support from the mental health counseling and our ease of access to some of those supportive things that, for people that are really struggling. We try to really keep an eye on that and be able to support them through that. But I will say, as challenging as it's been over the last 10 months, I can't imagine an organization that would be more well prepared than we were to take it on. Our teams have learned a lot. I know personally, I've learned a lot about incident management and an emergency situation that just goes on for months and months, which is very unusual for what we typically deal with. But we've grown from it. Personally, I think I could speak for the panel here. We feel empowered coming out of this, that we could take on anything, just bring it. We're ready for it now. But we've been keeping a very close eye on our employees and our doctors, and doing the very best we can to support them through all of that. But it really speaks to how prepared we were going into it, because we really had no time to prepare that this was coming. In terms of what Herbert has mentioned around the work that's been done on the outpatient side and on the care management, the support of our patients, that has been fundamental in terms of being able to be a part of a community project, because we've got the patients in the hospital, we're taking care of them, we've got all of our supplies, we're working all those angles. But when they're not in the hospital, they still need support. We have to find ways to get to them, get to their community. And we have been able to stand up things like mobile COVID testing sites anywhere that the region needs us. We work directly with our public health office, and they say, hey, we've got an outbreak over in Eunice. We need you to go over there. We'll mobilize the team and do it. And what we've found through that is, number one, we can do it. Number two, the community, it's so obvious that they find us trustworthy, that they find we have brand loyalty around this area, that when they see us, they trust that we know what we're doing. They trust that we have their best interest at heart. And that's been overwhelming from that kind of response. We've been able to take that population health kind of platform and pivot it into some of these other areas that have needed our attention, and do it quickly. The most recent example, as you mentioned, Morgan, is vaccine administration. It's huge, and it's not even as big as it needs to be yet. And so we are, for all the reasons I mentioned, we're taking those teams, amplifying them if we need, using volunteer support, and working directly with the public health department and all of the other leaders in the area, that healthcare leaders that we have come to be closer with through COVID, to have a joint effort to get out into the community and give as many vaccines as we can get our hands on, and get people protected so that we can come out on the other side of this pandemic.
Dr. Logue mentioned the response in the different communities, and going back to those things that I'm most proud of is the response of all of the communities that we serve, and them turning to Ochsner Lafayette General as the source of truth, as the leader in the community, whether it was in taking care of loved ones in the ICU, or testing, or now vaccine administration, the communities have turned to us, and that's why we're here. That's why we exist, and our ability to be able to serve our community through this extremely difficult time is certainly something that I think we're all very, very proud of, and is also a perfect example of a benefit of the merger and being part of something larger, because we've been able to learn from New Orleans and Baton Rouge and Shreveport, and they've been able to learn from us. And in a time like this, where everyone is trying to figure it out, the more great minds that are involved, the better. And that has been a huge, huge benefit to our community and to our organization.
Yes, absolutely. And Dr. Logue mentioned how this whole, how the response to the pandemic has actually been empowering to the care teams at Ochsner Lafayette General. And I think that really just speaks to the great work of all the teams as we come together. Patrick, you mentioned the merger, how we're pulling so many great minds, everyone's individual experiences in their region to find the best solution. So it's empowering to me just even hearing you guys talk about it, as it's something that we experience every single day. And I think now more than ever, we are in need of clinicians to care for our patients. Healthcare is growing, Ochsner Lafayette General is growing, so there are many needs to be able to support the region and just support our state of Louisiana. So I love hearing you guys speak about that. I think now would be a great time, Sheena, to have you touch on how somebody that is interested in joining the Ochsner Lafayette General team, how they can get access to your career opportunities and what would be next steps for them to join this team.
I would be happy to share that. And just as a reminder to everyone, again, it's not just clinicians, it's our support staff as well, professional services. We're looking for all of you. And we want you to join our team because we are truly making a difference. And I can assure you that what the panel has shared with you today is our everyday life. We are passionate about what we do. We enjoy this culture and we want you to come join us. And so the way to do that is to head over to our website, LafayetteGeneral.com/careers. You'll see all of our available openings there. You can also email our recruitment team at recruitment@lgh.org, and someone can absolutely reach out to you and discuss the available opportunities that we have within our region.
Thank you, Sheena. I feel like this has been such a great experience being able to connect with you and share a little bit more about the leadership team that we have at Ochsner Lafayette General, and kind of answer some of these great questions today. For anybody that's joining us live, we appreciate you tuning in and learning a little bit more about this great team and the region in which they serve. As Sheena mentioned, if you're interested in learning more about career opportunities with Ochsner Lafayette General, you can visit LafayetteGeneral.com/careers, where you can access all of that information. Again, thank you to my panel for joining us today. It has been such a great experience, and I hope everybody has a great Thursday.